Hi, this is Dr. John Corey, and today our 2-minute surgeon is going to be a little different. Sometimes we're a little more lighthearted about this, but today we're going to talk about a subject because of a recent FDA announcement regarding what's called ALCL, or Anaplastic large cell lymphoma. What we've been tracking over the last probably 10 to 20 years is there have been accounts of a lymphoma-type reaction to breast implants. It really doesn't seem to have anything to do with the silicone gel itself. It has to do with getting an implant in your body. And we know that there are some implants that have caused this in the past that aren't associated with breast implants. But what this seems to be is a lymphoma-type reaction to the implant itself, probably the shell of the implant, not really the silicone inside of it. And it can be seen with saline implants, it can be seen with silicone implants. This type of lymphoma is probably more predisposed in people that have a history of lymphoma in the past, and it seems also to be associated with people who have had textured type of implants rather than smooth implants. Here we see a textured type of implant. It has a fuzzy covering on the end of it, on the outside of it, and this implant is a smooth type implant. So it seems to be associated, what we know so far, is it's associated with these textured type implants. Let's talk about some of the raw numbers that we know. Over the last 10-year period, at least in the United States, probably 3 million women have received breast implants. There have been 359 documented cases of ALCL out of those 3 million. Now, over the last 20 years probably, or worldwide, 10 million women have probably had breast implant surgery. But in the United States, 359 cases have been documented, and of those 359, there have been 7 or 8 fatalities. We think those are in women mainly who allowed the disease to progress or had a predisposition already to lymphoma-type diseases. Now, the good news is this type of lymphoma reaction seems to be relatively straightforward to diagnose and not terribly virulent. Once the implant is removed and once the capsule around the implant is removed, patients seem to do very well. The treatment seems to stop the progression of the illness. The type of reaction, this lymphoma type of reaction, again, responds very well and not much other treatment is needed. The other thing is, how does this present? What is a patient really looking for? It seems to present as unilateral swelling, meaning just one side gets very swollen for no reason and gets much larger than the other side. It's diagnosed by taking the fluid out from that pocket and sending it off for pathology and for analysis. Do I use textured implants in my practice? I do. I don't use them a lot. I use them in certain cases, and I do believe they have an advantage over the smooth type of implant. But I do take all those precautions, and I, in my practice in 25 years, have never seen a case of this. But I think it warrants discussion, and the FDA has brought that to everyone's attention, so that's why we talk about it. But let's talk about some of the things we can do proactively to try to prevent this, at least what we know so far. There are several things we think help. In the operating room, we can scrub the implant with an antibacterial before we place it in the space where we want it. The other thing we can do is we can change our gloves each time we handle a new implant. We can tape off certain areas of the breast which may contaminate the product more than others. So those are things that we can proactively do in the operating room to help reduce the incidence of this. We think every patient receiving breast implants, I think, should be aware, and really specifically patients receiving a textured type implant should know what to look for and discuss with their doctor their history and family history as well. This has been John Corey and the 2-Minute Surgeon.